Of all the advice I have given men over 60 and 30 years of urology practice, the advice I am about to share in this video is the advice that generates the most disbelief when I first say it, and the most gratitude 2 weeks later when it works. Because the two mistakes I am going to describe today are so common, so universally practiced, and so deeply embedded in what men believe is smart bladder management, that almost every man I have ever told has initially pushed back. And almost every man who trusted the process and tried it anyway has come back changed. The first mistake is going to the bathroom just in case. You know exactly what I am talking about. You are getting ready to leave the house. You are heading to bed. You just had dinner. You are settling in to watch television. And even though you do not feel a strong urge, you think, I should probably go, just in case. I'm going to be sitting for a while. Better empty my bladder now. It seems logical. It seems responsible. It feels like good planning, and it is one of the most damaging habits a man over 60 can develop. Here is why. Your bladder is a muscle, a hollow muscle that stores urine and is designed to hold between 14 and 18 ounces before sending a legitimate urgency signal to your brain. When you urinate before you feel a genuine urge, when you go just in case, you are emptying the bladder at 40, 50, 60% of its capacity. Every time you do this, you are reinforcing a new, lower threshold in the neural communication between your bladder and your brain. Over weeks and months, your bladder literally learns to send urgency signals at a lower and lower volume. What started as a bladder that could comfortably hold 16 ounces now sends panic signals at 8 ounces. You have trained it to do that. And at night, when your bladder fills to that new lower threshold while you sleep, it wakes you up. Let me tell you about a man named Kenneth, 66 years old, from Atlanta, Georgia. He came to me with what he described as an overactive bladder. He was urinating 12 to 14 times a day and waking up 3 to 4 times a night. His bladder had been scanned. His prostate had been evaluated. Everything was structurally normal. When I asked him to walk me through his typical day, the just-in-case pattern was everywhere. Before he left for his morning walk, before breakfast, before every car trip longer than 15 minutes, before every meal. Kenneth's bladder was not overactive. It had been systematically undertrained to hold almost nothing. We put Kenneth on a bladder retraining protocol. The principle is simple, though the practice requires discipline. When you feel the urge to urinate, you wait. You do not go immediately. You practice what is called urge suppression. 3 slow, deep breaths in through the nose and out through the mouth, combined with 4 rapid pelvic floor contractions. This activates the inhibitory neural pathway that tells your bladder to relax and hold. You postpone urination by 5 minutes in the first week, 10 minutes in the second week, 15 in the third. You gradually extend your voiding intervals until you are going every 2.5 to 3 hours, which is the medically appropriate and physiologically healthy pattern for a man over 60 with a functional bladder. Kenneth did the protocol for 4 weeks. His daytime urinations went from 14 down to 7. His nighttime trips went from 4 to 1. In 4 weeks, with no medication, with no procedure, just retraining the neural pathway that had been conditioned incorrectly. The second mistake is double voiding, but doing it wrong. Many urologists, including myself, recommend double voiding for men with enlarged prostates. The concept is sound. You urinate, then you wait 30 seconds and try to urinate again to empty any residual urine in the bladder neck. But here is the mistake that almost everyone makes. After the first void, men stand at the toilet and strain. They push. They try to force residual urine out by increasing abdominal pressure. And this is the wrong approach entirely. Straining and pushing against a bladder that has already emptied its primary volume triggers what is called a detrusor overactivity response. It artificially stimulates the bladder muscle to begin its next contraction cycle prematurely. Men who habitually strain at the toilet are essentially giving their bladder a repeated false start signal that carries over into their sleep, where the bladder initiates contraction cycles earlier and earlier in the night. The correct double voiding technique is passive. After the first void, take 3 slow, deep breaths. Lean slightly forward from the hips, 30 to 40 degrees. Wait 30 seconds without any straining or pushing. In that relaxed, leaning forward position, gravity and the natural elasticity of the bladder wall will drain any remaining residual urine on its own, without any muscular effort. This passive positional technique empties the bladder more completely than straining does and leaves the detrusor muscle in a resting state, rather than a primed state. Before I give you the complete combined protocol, I want to take a quick moment. Many of you watching have asked me about quality supplements for bladder health and prostate support. I have personally shortlisted a few vitamin and supplement suppliers whose products I genuinely believe are worth your attention. You will find them linked in the description below. These are there because you asked, and I want you to have access to things I have actually reviewed. Here is the full protocol. Stop all just-in-case urination immediately. Urinate only when you feel a genuine urge, a 7 out of 10 urgency level. When you feel an urge below that level, practice the urge suppression breathing and pelvic contractions, and wait. Use the passive double voiding technique every single time. Forward lean, 30 seconds, no straining. And add this one final element. Before you get into bed each night, perform the 10-second pelvic floor pre-activation I described in another video on this channel. The combination of these three elements is what I call the bladder reprogramming trifecta, and the research supporting each individual component is substantial. A randomized trial from King's College London involving 168 men over 60 with nocturia and overactive bladder symptoms showed that men who completed a 6-week behavioral retraining program using urge suppression and voiding interval extension reduced their nighttime urination episodes by 63%, compared to 29% in the medication-only control group. Behavioral retraining outperformed medication. In a clinical trial, with men over 60. The man I want to close with today is named Arthur, 70 years old from Seattle, Washington, former university professor. He had spent 3 years treating his nocturia with medication, dietary restriction, and limitation of activities. He would not go to evening events because he was afraid of needing to urinate. He had stopped going to the theater. He had stopped taking long drives. His world had gotten smaller because of his bladder. After 6 weeks on the behavioral protocol, his nighttime trips were down to 1. His daytime trips were normalized. He went to a 3-hour symphony concert with his wife for the first time in 4 years. He sent me a photograph of the two of them dressed up, smiling, and said, "You gave me my life back." That is what this work is about. Not just fewer bathroom trips. Life back. Start tonight. Stop going just in case, and start reprogramming. Leave me a comment below and tell me, do you recognize yourself in either of these mistakes? I want to know. Like, subscribe, and I will see you in the next video.